What's up guys? It's Daddy McCoy and welcome back to my channel. Ang topic natin for today ay ang question mula doon sa last post ko na a day in my life as a wound specialist nurse. Ang tanong, paano daw ba maging wound ostomy nurse? So, pag-usapan muna natin, ano ba ang WOC or wound ostomy continence nurse, diba? It's a specialty. You have to further study for this specific certification. So, iba't ibang certification yan. So, 3 beses ka rin mag-aaral para doon. Pwede mo siyang kunin isahan or pwede mo siyang kunin one at a time. Diba? So, WOC nurse focus more or they provide direct care on patient with integumentary, gastrointestinal, and gastrourinary problems. Specific sila doon. Bali, more on consultation sila. They're not limited with wounds, fistula, drains, madami silang kino-cover doon sa trabaho. So what are the criteria for admission? Siyempre, first, you have to be RN with BSN or yung Bachelor's of Science in Nursing. Pangalawa, kailangan meron kang RN experience at least 1 year after mo mag-pass nung board exam or yung NCLEX. Pangatlo, kailangan meron kang at least 1 year of experience within the last 5 years before ka mag-apply ng WOC program. Kasi merong mga RNs na natigil, 'di ba, magtrabaho sa acute or subacute settings and then mag-a-apply sila. Hindi po pwede yun. Kailangan meron kang at least 1 year, 'di ba, before ka mag-apply nung program. So, saan ba dapat mag-apply? So, there are only 5 schools or institutions here in the United States accredited by WOC Society. Ilalagay ko na lang yung link sa baba para ma-check mo, okay? So, there are 2 pathways for you to be able to get into the program. One is the traditional way, which means you have to apply, met all the criterias, alright, go into the didactic and the clinical portion of it, and take the exam. Okay, that's the traditional way. On the other hand, it's the experimental way. Some says that it's very tricky, it's cheaper, but it's longer. Okay, so what you need is 50 hours of continuous education related to wound, ostomy, and continence on each specific specialty yun ha. So 50 hours sa wound, 50 hours sa ostomy, and 50 hours of continence. And also, what you need dun sa experimental way or pathway is 1,500 direct contact hours on each specialty. So, ang dami nun. So, one of my friend, she actually did the experimental pathway for the ostomy piece. So, it took her 4 years, I think. 4 years for her to be able to complete all those. Kasi CEUs, medyo mahirap siya and then kailangan accredited yung hours mo per specialty. So, di ba, medyo tricky talaga yun. So, most of us na nakilala ko, traditional way yung ginawa, which is nag-aral na lang, nag-exam. Di ba? Kasi mas madali yun. Like, it will take you like what? 6 months for all of it and then you're done. Di ba? Compared to the 3-4 years, diba? And well, the traditional way, it's quite expensive, but you can look into the schools below, sa link below, kasi every state has different prices, diba? So pag-usapan naman natin yung exam application fees. So ipopost ko siya dito. Yan. Exam fees are reduced significantly when multiple specialty exams are in one exam application submission. One specialty is $395, 2 specialties $510, 3 specialties $610, 4 specialties is $670. So yun yung exam fees natin. So bakit apat? Siyempre, wound, ostomy, and continence. Kasi yung iba kumukuha ng diabetic and foot. Yun, mas specific sila doon. So, yun yung pang-apat. Pero ako, personally, ang kinuha ko lang, wound and ostomy. Bakit wala akong C or yung continence? Kasi dito sa California, we don't have a continence clinic. So, that's the only reason bakit hindi ko na siya kinuha. Sa hospital, ang mostly tinitreat namin are moisture-associated skin damage. So, connected siya dun sa moisture which is from the urine and stool, di ba? So, yun yung part ng continence part. Pero, kasi natakal na yun doon sa wound part. So, medyo may idea ka na. So, kaya naman i-manage kahit walang certification. Pero, mas marami kang matututunan kapag kinuha mo yung continence part. Dito kasi sa California, walang nag-offer ng continence piece or specialty. Kaya hindi ko na rin siya kinuha. That's another reason. Ayoko naman pumunta pa sa Georgia para lang kunin yun and stay there for about 2-3 months. Diba? Kasi medyo magastos. And sa hospital na pinagtatrabaho ko, required lang naman nila is yung wound and ostomy certification. So, hindi ako WOCN, ako ay CWON or Certified Wound Ostomy Nurse. Sa mga nagtatanong na iba, how long daw ba yung recertification process nito per specialty? It's every 5 years yung recertification. So, you have to take the exam every 5 years. It depends on how many specialty you have. So, in my case, I only have wound and ostomy. So, I have to take the exam every 5 years for recertification. So, yung WOC program is limited only for nursing with bachelor's degree. Pero paano daw kung yung LVN or LPN or physical therapy assistant or doctors gusto nila mag-take ng wound specialty? Pwede ang ibang discipline. So, punta kayo sa abwmcertified.org. Andyan yung mga resources na kailangan para dun sa certification na yan. Just to give you a brief summary. So, ang eligibility nun, syempre kung RN ka na gusto mo lang mag-specialty sa wound, pwede din yun. Or PT ka, physical therapist, doctor ka. So, ang requirement is meron kang masteral, bachelor's, or doctorate. Yun, para sa mga discipline na applicable doon. Tapos, at least 1 year of experience sa wound part, sa wound role. It doesn't have to be na yung role mo lang is about wound, pero at least doon sa 1 year experience mo na yun, meron ka mga wound care experience. So, pwede ka mag-apply. Para naman sa mga physical therapy assistant or LV and LPN, meron tinatawag na Certified Wound Specialist Assistant or CWSA. Okay? Same thing din. Kailangan meron ka lang clinical experience of at least 1 year. It doesn't have to be wound-specific role. Basta meron ka lang experience dun sa role na yun. Okay? At syempre, aside dun, kailangan meron kang current license na hindi napaso or walang violations. So for the CWS and CWSA, currently today, yung exam fee is $575. And it is renewable every 10 years and you have to take the exam. Okay? So there's another route naman through WCEI.net. So ito naman, specialty specific siya. Wound, so magiging wound specialist or OMS, ostomy management specialist, or pwedeng DWN, diabetic wound nurse. Yun. So, sila, specialty specific. So, iba pa to dun sa WALK program, okay? Pero accredited sila ng WOCN Society. Dito naman sa WCAI, yung exam fee naman dito is $300. Okay? Iba-iba din yung presyo nila per certification or specialty. So, dito sa WCAI, mayroong 4 ways how to renew yung certification mo. So, one is to attend the entire program again, which cost about $2,500 ata, if I'm not mistaken. But you don't have to take the exam. So, that's every 5 years, diba? And the other one is take the exam. Review, take the exam. And bayaran mo yung $300 na exam fee. Third is 60 contact hours. You can accumulate 60 contact hours in 5 years. Pero dapat accredited to. And it's specific for wound and skin. Okay? And fourth, to become a NAWCO preceptor. So, check nyo na lang yung website para ma-sure. Okay? So, ito lang yung mga alam kong website. Pero I'm sure meron pang ibang website. Pero make sure na accredited sila ng NAWCO or WOC Society. So yung tuition fee nitong abwmcertified.org and wcei.net ranges from $2,500 to $4,000 per specialty. So go to the website na lang para ma-check nyo kung magkano talaga each specialty. Pwede mo naman kunin installment kung hindi mo kaya. Kunin mo one specialty at a time. So pwede kunin mo yung wound, exam ka. Pag pumasa ka na, next naman. Yung ganun, pwede para hindi mabigat sa bulsa. In my case, yung company ko, nagre-refund sila or nagre-reimburse sila ng tuition fee up to $2,500. So, malaking tulong yun. Bali dun sa tuition fee, hindi kasama din yung background check, yung fingerprints, physical and drug test exams. No? Hindi siya kasama. So, additional pa yun. Parang miscellaneous yun. O diba, ang mahal-mahal mag-specialty, pero magkano ba ang sweldo ng WOC nurse? So, ipa-flash ko na lang sa screen. So, bali pag-usapan na lang natin guys ang salary dito sa California kasi dito ako naka-base. So, according to statistic, it ranges from $58,986 to $394,000 and with an average of $119,000 per year, with an average of $57 an hour as of January 5, 2021. This is the average pay of WOCN in California. Pero guys, hindi yan talaga yung sweldo natin. Okay? Mas malaki dyan. Kasi it depends kung saang lugar ka sa California. Siguro itong mga, in 58 siguro, ito yung sa mga, liblib na lugar. Joke, hindi ko alam kung paano nila kinuha ito. Statistics na to. Pero, ang alam ko, hindi umabot ako ng 394 annually. Maganda magkaroon ng specialty kasi mahirap maging floor nurse. Siguro yung karamihan mag-agree pero mahirap din mag-specialty kasi maraming nakapatong na responsibilidad sa balikat mo, di ba? Pero mas mataas yung sweldo. Meron akong mga kakilala sa ibang institution, $100 an hour sila or sometimes nag-range sila from 80 to 110 an hour. So, may mga kakilala kong ganun. So guys, nasagot ko na yung tanong kung paano maging WOCN or a specialty nurse sa wound and ostomy. So, yan po yung way. So, bali ako, ang way ko is medyo dalawa siya. WCEI ako and then nag-enroll din ako sa San Jose State University para dun sa mga programs. So, ngayon, ang role ko is wound ostomy nurse. So, we cover both inpatient, which is acute settings, that includes ICU, telemetry, med-surg, orthopedics, ER, and psychiatric nursing. Also, napupunta kami sa mga wound clinic din to assist yung ostomy piece task nung clinic. Kasi dito sa clinic namin, sa hospital, mostly ang nag-work doon are physical therapy wound specialists. So they handle all the wounds in there. But pag meron ng ostomy patient, tinatawag na kami. Okay, so bumababa kami from inpatient dun sa clinic para tulungan sila for the ostomy part. So yun lamang po dito. Short and sweet, but I think I have to do another video kung ano yung talagang mga responsibility namin. And syempre, mag-share tayo ng mga experiences, diba? Kung paano yung nangyayari dun sa loob ng ospital. Yan. Or mga techniques na din. So, let me know, comment down below kung ano yung gusto nyong malaman dito sa wound ostomy, lalo din sa mga interested. Ano ba yung mga gumugulo sa utak nyo? Para naman matulungan kayo makapag-decide kung ito ay para sa'yo. Kasi, yung iba inisip nila, ay gusto kong mag-wound care. Pero, hindi kasi ganun kadali eh. Ang daming task, ang daming responsibility na yung management nakaasa dun sa assessment mo. So, kung gusto nyo malaman yung mga details na yan, comment down below para before kayo mapasubo dyan sa specialty na yan, buo yung loob nyo, diba? Hindi yung pagkakuha nyo. Kasi may mga kilala ko na kumuha sila ng specialty, pero pagdating doon sa site, parang, dapat hindi na lang ito yung kinuha ko. Dapat nag-nurse practitioner na lang ako or something, diba? Kasi, basta, yun. So that's it for this video, guys. If you like this video, please click the like button down below. And also, if you haven't already, please click the subscribe button and also the notification bell para ma-notify ka ng mga bago nating videos, okay? Maraming salamat sa panonood. Laters!